Hello out there from Mainly Birthing. This is Laura Duffy coming to you live from our studio. And I am very excited to have my friend Dr. Rebecca online in the studio today. And we are going to be talking about handling lower back pain during pregnancy. Dr. Rebecca is originally from New Hampshire, but her office is now in Biddeford, Maine. And she, at the age of 14, actually worked for a chiropractor's office, fell in love with everything to do with chiropractic, including the connections that she makes with the people that she works with. So she went to school, she got trained, she's all set now, and she is going to join us and give us lots of answers to the questions that we have. So welcome, Rebecca, to the show.
Hi, thank you guys so much for having me. I'm excited to be here.
Hi, that is so good. So you're from New Hampshire, but you opened your office in Biddeford. So how did that happen? When did that happen?
So it was really kind of serendipitous, to be honest. When I finished up chiropractic school, I went to school in Georgia, and my husband and I were getting super homesick. We never thought we would come back to New England, actually. But when I decided that, all right, we're going to make the move back, we had a search range from Portsmouth to Portland. And never thought I would really be able to purchase a building, but Biddeford was the place where I was able to purchase some property, and we actually own a piece of history, and I'm really proud of it. Our building is 119 years old.
Oh, wow.
So, yeah, it's got all of like
awesome.
beams and floors, and yeah, I love it. So
that is so great. That is so great. And you're right in Biddeford, which is awesome, and it's wonderful weather we've been having. I'm so glad that you were able to make it on the show.
Yeah, there was a little snafu this morning, frozen pipe. All of you Mainers, I'm sure, know how that goes. So, but I'm here.
Yes, because we're just making it happen. Because we have questions for you, and we're so excited to have you here, our professional. Yes. So one of the questions that I have is, for me personally, when I reach out to a chiropractor, it's because I've done something to myself. Like, oh my gosh, I did something. But I do want to go more just for preventative care. So I wasn't sure with your practice, who do you get more? Like,
so I would say it's really kind of a healthy balance of the both. I do see a lot of people, especially this time of year, shoveling is something that we're all doing right now. So a lot of low back stuff with the shoveling. But overall, since I do see a lot of pediatrics in my office, thankfully that's really more preventative care. Sometimes when younger patients are coming in, it could be to start off with like an ear infection. And then once we work through that, it's kind of like they're on maintenance care to prevent further things from happening. I do also see a lot of young athletes. So cheerleaders and hockey players and football players. And for those, it's really their parents bringing them in, knowing that they're going to be taking some hits during the season and want to keep them, feeling their best and performing their best. So really a good mix of the both.
Yep. That is so awesome. That is so awesome. And so expectant moms, they come to see you as well. So I know that we're going to be discussing lower back pain today, but there's probably a variety of things that they come in for.
Yeah. So some of the things that I see expectant moms for are definitely morning sickness. Unfortunately, that's a really common one. But adjustments really tend to seem to help. So I've gotten some great results with that. Acid reflux is another big one that's not a musculoskeletal problem that a lot of people, I think, are a little more surprised about. And then, of course, the old classic low back pain and sciatica. Those are really kind of the bread and butter when it comes to prenatal patients.
Yes.
Perinatal, actually. Yeah. All through pregnancy, 4th trimester, we're seeing a lot of back pain.
Oh my gosh. You mentioned sciatica and everything just came flowing back.
Unfortunately,
with our second, that was an experience that we had, but that's for another, you're going to explain it
later on in the interview. Yeah.
Awesome. So lower back pain. Is it normal, like with pregnancy, or?
So one of the things I like to talk about a lot in my office is the difference between normal and common. So low back pain in pregnancy is definitely common. I do see it quite a bit, but it's not necessarily always normal. So one of the things, the reason why kind of that's happening and why it is so common is that as the baby is growing in the mother's womb, her center of gravity is also changing. So if you think about, you've had this one posture for pretty much your whole life, and then you're growing a human being, and your center of gravity is changing quite drastically. You know, every month as you're growing, the gravity is changing. So of course it's going to affect our posture, and it also affects our balance. So especially here in Maine in the winter, that's something I really caution my pregnant moms about, is being careful on the ice. You know, we have so many things changing. It's really important, you know, get the spikes for your shoes, do whatever we have to protect you. So yeah, that's really one of the reasons why it's happening. Another huge reason why we see low back pain in pregnancy is that, as you know, we have a lot of hormonal changes during pregnancy.
yes. Yep.
And one of those hormones, and our body is so smart, why it does this, but one of the hormones is called relaxin. So it's very cleverly named because it literally does relax our ligaments and help soften some of our joints so that delivery is much easier once it's ready for that time. But the kind of other edge of that coin is that it also softens ligaments in our spine. So it can create some instability and therefore cause some pain. So that's why, especially for me, chiropractic care is so important, is to make sure that we're lined up, strengthening some of the other muscles that support and stabilize the spine to ensure that you're going to make it through this pregnancy.
Right. Oh my gosh. And that makes total sense. Like everything you just said, which is why we have you here today.
I'm happy to be here.
That's awesome. So what are some of the techniques that you use when someone comes to see you?
Definitely. So just in general, I use a lot of different techniques, and I think you'll find that's pretty common with most chiropractors. I was really fortunate to go to my chiropractic school that gave us a background in everything and then kind of said, choose what you like. So I love that.
Yeah.
So I use a huge mix of what's called diversified, which is also known as full spine. So that's kind of your typical, what people think of when they think of chiropractors right off the bat. That's pretty much the most common one. So that's going to be, you know, you will hear some pops in your back. It just is the gas being released within the joint. People are always like, are there anything actually cracking? I promise not. If you're doing it right, nothing's cracking.
Yeah.
So yep, I use diversified. I use a technique called Thompson. Thompson's really great because it utilizes a special table that pieces will actually lift up underneath of you. And then I use my hands, my body to drop the pieces down. So it's really gentle on your body as a patient, and it's also really gentle on my body as a doctor. So it's kind of got some dual benefit. And especially in pregnancy, I love to use Thompson to adjust the pelvis. I also use something called Activator. That uses an instrument, another pretty common, I guess, technique. So people have probably heard of that. But it's an instrument. It does use a very small, gentle impulse. I use it a lot for pediatrics. Older adults, I use it for the jaw, ribs, and things like that. And then I also have an instrument called an arthrostim. So if that's translated, arthrostim just means joint stimulator. But the great thing about that is it's very similar in the idea of an activator, but it actually impulses 12 times a second. So it helps us hold our adjustments for a lot longer. It's a really, really great tool that I love to use. And then in pregnancy, I use a special technique called the Webster technique. Yeah. And so with that technique, I know you've got a question about that, so I'm just going to go ahead and answer it.
I know. I'm like, that's the one. Yeah.
Yeah. So. Awesome. So with Webster, it is a special certification. So not all chiropractors have this. But really what it is, it's a special technique to balance the pelvis of a pregnant mother. Really, it's specifically focusing on the positioning of the sacrum, which is that triangle bone right at the base of our spine. So of course, in pregnancy, a lot of the nerves that control things like uterine function, the genitourinary system in general, is really closely tied into that low back system and the sacral nerves. So that is really, really, talk about VIP for a pregnant mom.
Oh my gosh.
Crazy. Yeah, exactly. And then it also focuses on actually some ligamentous and some muscular work. So we talk about things like the uterosacral ligament and the round ligaments and balancing those to give the mom and the baby, I like to say, the most room in the womb. That way.
That's so important.
Exactly. It's an easy way to explain it. And really that kind of describes the benefits.
Yeah. Yeah. No, that is fabulous. And that's one of the things that I've heard about the most. So thank you for explaining that. So that is so good. Now, are there things that a mom can do, like say she can't make it to your office like this week or something like that? Like, are there things that mom can do with her diet or with her posture or like like at-home techniques or something that can help with the lower
Definitely.
back? Okay.
So one of the things that's the most important is really staying active throughout your pregnancy, as long as, that's not contraindicated by your OB or your chiropractor. Things like low impact exercises like yoga are fabulous. Swimming is actually great too if you have access to a pool, which is a little bit harder. But even if you were to go to YouTube and do prenatal yoga techniques, again, check with your OB. But that's a really fabulous way to kind of stay in shape and avoid that low back pain if we can. Another couple quick little tips are, if you're going to be carrying anything during pregnancy, you really want to distribute the weight evenly. And especially if it's not your first pregnancy and you've got another little one running around, no matter how old they are, if you're helping pick up the kids, if you've got a baby on your hip, just make sure that you're switching from side to side, because a lot of excess pressure on one side will really throw off the whole system. And then one other thing I really like to recommend to a lot of my patients, or again, if you can't make it into the office, is be really cognizant of your posture. Typically with pregnancy, that includes kind of tucking your pelvis under if you can. It's going to feel a little funky when you're trying to, test it out at first.
Yeah.
But what happens is, especially with that shift in the center of gravity, moms' low backs end up becoming kind of like a sway back. It's called hyperlordosis, so excessive lumbar curve.
That makes sense.
Yep, if we can avoid that at all costs, that also will be really helpful for low back pain. And sleep position. One more thing, sorry.
That's okay. Sleep is important. And
sleep position is so important. And I think a lot of people know that there are so many great options for pregnancy pillows out there nowadays. But the reason why that's so important, other than just you feel more comfortable, is that typically there's part of the pillow that goes between your knees. And why that's so VIP for us is that it helps keep your pelvis balanced versus letting one aspect of your pelvis kind of fall forward if you don't have that in between your knees.
Yeah.
And sleeping on your side is really the best position when you're pregnant.
Yeah. And one thing that I love about learning how to stay healthy and up to date, like with pregnancy, is you can use some of those techniques whether you're pregnant or not.
Exactly. A lot of it carries over.
Yeah, so I absolutely love that. Well, that is awesome. That is so great. And now you've been doing your own videos as well. So what is the best way for people to get more information on you or touch base with you? We added the link to your website, and we'll add your Facebook link as well. But what is the best way for people to get in touch with you?
So really, those are the two biggest ones. Facebook is probably your best bet. I do a lot with social media. Education is so important for me, especially with perinatal care, because I think a lot of people just don't know if chiropractic's an option. I've had a lot of my new patients that are pregnant kind of come in and be like, I didn't know, but I saw something on your website. So if that's a question for you, please reach out to me. I'm always happy to talk to you on the phone, schedule a consult in person. Even if you're not in my area, you can't make it to Biddeford, I'm happy to talk to you and help find somebody who can help you. So definitely Facebook would be the best. I'm always on here doing Facebook Live videos about something or another. So if you want just more information just about, life, motivation in general, or chiropractic, I've got something for you, I'm sure.
That is awesome. And I have seen a couple of your videos, which I absolutely loved. So you're just very easy to just talk to, and people want to call you and talk to you. So thank you so much for being here.
Of course.
So what I'm going to do is like I said, I have your information in the link, and I'll add another for your Facebook. And then if anyone has any questions, hello to all of you out there in Facebook land. If you have any questions, definitely feel free to post them in the comments.
Yes, please do.
And Rebecca, you'll be able to get back to them on that. So, all right. Well, it was great to talk with you today. And good luck with winter in Maine and the continuation of that.
Keep your fingers crossed for my pipes, please.
Yes, fingers crossed for your pipes.
Yeah.
It'll be good.
Thank
you.
Right.
Well, thank you so much, Rebecca. I hope you have a wonderful day, and thank you from all of us at Mainly Birthing and the Facebook world, and we'll be in touch.
Thank you guys so much for having me. Bye, guys.
Bye.